You know, if you're a man or you care about the men in your life, you've probably heard stories about older men facing challenges with urination, all because of one small organ called the prostate. Maybe you've wondered, is there anything we can actually do to protect ourselves or the people we love from these issues down the road? Well, I'm Dr. Nerea Wolf, urologist and pelvic surgeon, and if you ever have questions or concerns about your urological health, I want you to feel comfortable staying with us. We're here to help you understand your body with clarity, compassion, and confidence. Today, we're going to talk about something that matters deeply to so many men: preventing prostate enlargement. What can you actually do? What's within your control? Let's walk through this together. First, let's talk about what the prostate actually is and why it becomes a concern as men age. The prostate is a small, walnut-shaped gland that sits just below the bladder, wrapping around the urethra, the tube that carries urine out of your body. In younger men, it's typically small and quiet, doing its job without causing any trouble. But as men get older, the prostate tends to grow, and as it grows, it can press against the urethra, making it harder to urinate comfortably. This growth often progresses in stages. What starts as normal prostate tissue can develop into something called hyperplasia, a fancy word that just means an increase in the number of cells. Over time, some men develop abnormal cells, and in certain cases, even prostate cancer. But here's the important question: can we stop this process? Can we slow it down? To answer that, we need to understand what drives prostate growth in the first place. During adolescence and early adulthood, the prostate needs something called androgens to grow. Androgens are hormones like testosterone. When testosterone reaches the prostate, an enzyme called 5-alpha reductase converts it into a more potent form called DHT, dihydrotestosterone. DHT is found in much higher concentrations in the prostate than regular testosterone, and it binds to receptors in the prostate cells, signaling them to grow. Now here's something interesting. As men age, their testosterone levels actually tend to decline, yet their prostates continue to grow. So while androgens are necessary for prostate development early on, they're not the sole cause of the enlargement that happens later in life. This condition we're talking about is called benign prostatic hyperplasia, or BPH. If you want to dive deeper into BPH itself, what it is, how it's diagnosed, and what treatment options are available, I've made a detailed video on that. But today, we're focusing on prevention. What can you do now to reduce your risk or slow down the process? To prevent something, we need to understand what causes it. So let's break down what's really happening inside the prostate when BPH develops. BPH is essentially an imbalance between cell growth and cell death. In a healthy body, cells are constantly being created and old cells are being broken down. But in BPH, the prostate cells, specifically epithelial and stromal cells, start multiplying faster than they're dying off. This imbalance is driven by certain growth factors, like epidermal growth factor, insulin-like growth factor, and transforming growth factor beta. So what causes this to happen? There are a few key contributors. First, genetics. BPH can run in families in what we call an autosomal dominant pattern. That means if your father had an enlarged prostate, especially if he needed surgery before age 60, you have a higher likelihood of developing it too. It doesn't mean it's inevitable, but it does mean you should be aware and proactive. Second, inflammation. You've probably heard the word inflammation thrown around a lot, but what does it actually mean in the context of the prostate? Inflammation can come from bacterial or viral infections, hormonal shifts, autoimmune conditions, or even urine flowing backward into the prostate ducts. It can also come from changes in the prostate's microbiome, the ecosystem of bacteria that lives there. When inflammation occurs, your immune system releases chemical messengers called cytokines, which then stimulate growth factors that cause prostate cells to multiply. And here's where it becomes a vicious cycle. As new tissue grows, it needs oxygen. But if it's not getting enough, the prostate releases inflammatory markers called reactive oxygen species. This creates more inflammation, which leads to more growth, which leads to more inflammation. You can see how this becomes self-sustaining. Third, metabolic factors. BPH symptoms can also be worsened by increased smooth muscle tone in the prostate, which is regulated by your sympathetic nervous system, the part of your nervous system that kicks in during stress. Things like fluctuating blood sugar levels, poor diet, and obesity can all trigger this system and make symptoms worse. This brings us to something critically important: metabolic syndrome. Metabolic syndrome is a cluster of conditions: diabetes, high cholesterol, high blood pressure, obesity, that often occur together, particularly in people who follow a Western diet high in fat, red meat, simple carbohydrates, and sugar, combined with physical inactivity. The numbers are striking. Men with diabetes have a 125% increased risk of developing an enlarged prostate. That's more than double. And when we look specifically at urinary symptoms, things like weak stream, stopping and starting, waiting for urine to begin, frequent nighttime urination, or sudden urges, diabetes increases the risk of those symptoms by 95%. Obesity is another major factor. Men with a BMI over 35 have more than a 200% increased risk of BPH compared to men with a BMI under 25. And waist circumference matters too. A waist circumference of 42 inches increases your risk by 138%. Even at 40 inches, the risk goes up by 48%. What this tells us is clear. Being overweight, having a large waist, and living with diabetes significantly increases your chances of developing an enlarged prostate. Now let's talk about what you can actually do. These aren't hypothetical suggestions. They're backed by real research involving hundreds of thousands of men. Number 1, increase your physical activity. A literature review that compiled 8 studies involving over 355,000 men found that even light exercise reduced the risk of BPH by 30%. Moderate exercise increased that benefit to 36%. One study found that walking for just 2 hours per week, less than 20 minutes a day, reduced the risk by 27%. Another study found that men who burned around 862 kilocalories per day through physical activity saw a 50% reduction in BPH risk, and men who exercised 6 times a week, a 51% reduction. That's profound. You don't need to become an athlete, you just need to move your body regularly. Number 2, be mindful of certain medications. Over-the-counter medications can worsen BPH symptoms, especially if you're already starting to notice changes. Antihistamines can relax the bladder, making it harder to push urine past an enlarged prostate. Decongestants like pseudoephedrine do the opposite. They tighten the smooth muscles in the prostate and bladder neck, making it even harder to urinate. Some antidepressants, particularly tricyclic antidepressants, can also worsen symptoms because of their effect on the bladder. This isn't about avoiding these medications entirely. It's about being aware, especially if you're already noticing symptoms. Number 3, focus on your diet. The best data we have comes from the prostate cancer prevention trial, which followed over 18,000 men for 7 years. They used detailed food questionnaires to track what people were eating, and the results were revealing. Men who consumed a high-fat diet, about 38% of their total energy from fat, had a 31% increased risk of BPH compared to men who ate less than 26% fat. Men who ate red meat daily had a 30% increased risk compared to those who ate it less than once per week. And men who ate fewer than 1 serving of vegetables per day had a 38% increased risk compared to those who ate 4 servings daily. The takeaway? A diet high in fat and red meat and low in vegetables increases your risk. A Mediterranean-style diet, rich in vegetables, moderate in fish and healthy fats, low in red meat, appears to be protective. And then there's lycopene. Lycopene is a powerful antioxidant found primarily in tomatoes. It's the pigment that makes them red. Some studies suggest that lycopene may reduce inflammation in the prostate and lower the risk of BPH. In the prostate cancer prevention trial, men who consumed lycopene regularly had an 18% reduction in risk. How much do you need? Studies suggest anywhere from 6 to 21 milligrams per day. A cup of tomato paste has about 19 milligrams. A slice of watermelon has 13. A cup of cherry tomatoes has about 4. It's not hard to get enough, and cooking tomatoes may actually increase the bioavailability of lycopene. But be mindful. Too much can cause side effects like digestive issues, bladder irritation, reflux, or even a slight orange tint to your skin in rare cases. Moderation is key. Number 4, avoid metabolic syndrome. This is the big one. Avoiding diabetes, high blood pressure, high cholesterol, and obesity is one of the most powerful things you can do to protect your prostate. These conditions don't just increase your risk of BPH, they affect your entire body and your quality of life. So here's what I want you to take away from this conversation. Prostate enlargement is common, but it's not inevitable. And even if you have a family history or you're already noticing some changes, there are real, meaningful steps you can take right now to protect your health. Move your body regularly, choose whole foods over processed ones, eat your vegetables, limit red meat, stay aware of how medications might affect you, And if you're living with diabetes or struggling with your weight, please know that addressing those conditions isn't just about the prostate. It's about giving yourself the best chance at a long, healthy, comfortable life. Your prostate doesn't have to define your future. With the right knowledge and the right choices, you can take control. If you found this helpful, I'd love for you to subscribe and share this with someone who might benefit. And if you're dealing with bladder issues, sexual health concerns, or pelvic pain, know that we're here to support you. Thank you for being here. And as always, take care of yourself because you're absolutely worth it.